Heart failure remains the #1 cardiovascular diagnosis. It's the one diagnosis that is increasing in incidence, as even though other therapies and other cardiovascular conditions are on the decline. And although we have made great strides, we still have a lot of room to go. There's still a significant mortality rate within 5 years of diagnosis for the average heart failure patient, not for every heart failure patient. So there's plenty of room. As I see it, there are several areas in which there is ongoing work. One is just looking at the patient who comes to the hospital, the acute decompensated heart failure patient. In those patients, we need to do a better job of managing their care and their transitions of care between the inpatient and the outpatient side, making sure that we follow them appropriately with the right types of outpatient support. It's probably more than just a doctor to take care of them, to make sure that many of these patients are very complex, and so managing their other medical complexity along with their heart failure is really key to preventing them from coming back to the hospital. So reducing 30-day readmissions is really, really important. That's what's best for the patient. The patient feels better if they're not in the hospital. They probably will live longer if they're not sick enough to require recurrent hospitalizations. So that's one area that I think have a lot of opportunity to impact on. There's some new technologies that help us with this. There's an implantable sensor that we've been using at Northwestern and others have been using for a number of months that help us identify patients who are going into heart failure, maybe even before they develop symptoms. And so we can begin treating them before they become symptomatic. And if we can do that, that's clearly been shown to reduce hospitalizations. So this device, it goes by the brand name of CardioMEMS. It's an implantable pressure sensor that we place through a vein in the leg up into one of the blood vessels in the lungs, and it sits there passively. It's a very small device. It can be interrogated or read from a reader that sits outside the patient, actually in a pillow that the patient lays on, and it transmits information about pressures in the heart to the web, and we can monitor patients remotely. And based on changes in those pressures, we can make adjustments in diuretics or other medicines that are more likely to keep them out of the hospital. Well, I would say for the most part, the patients who benefit the most are the patients who are having symptoms. Patients who are having symptoms despite being on medicines. Patients who have found themselves frequently having to go to the emergency room or frequently being admitted because it's difficult to manage their fluid. Those patients are prime candidates because the device is really indicated to prevent rehospitalization. So we sort of start with a population that's sick enough that they've had hospitalizations. Heart failure is very much a misnomer. Heart failure is a condition where the heart either doesn't pump enough blood to support the body or does so at such abnormal pressures that it causes a great deal of symptoms. And most of the patients are suffering from the latter part of that definition. And so heart failure occurs in a wide variety of situations. You can have other structural heart problems like valvular heart disease or coronary artery disease that leads to heart failure. There are some people who just have intrinsic abnormalities of their heart muscle, cardiomyopathies, and that lead to heart failure. So really one of the other areas that we've advanced is in our ability to diagnose etiologies of cardiomyopathies. This has been going on for some time, but one of the things we recognize now is that we have some much better imaging technologies with cardiac MRI and with PET scanning that help us delineate underlying causes of cardiomyopathy. Many of these are genetic abnormalities, but not all of them are genetic abnormalities. By getting a more specific diagnosis, we feel like we have a better chance of giving a more specialized treatment.